In preterm newborns, breathing failure most commonly occurs due to a condition known as respiratory distress syndrome. Before birth, oxygen delivery depends entirely on the placenta rather than the lungs. At birth, this support stops abruptly, and the lungs must immediately take over breathing. In preterm babies, this transition is difficult because lung development is incomplete. Respiratory distress syndrome begins when air spaces cannot remain open after each breath. In mature lungs, air spaces stay open throughout the breathing cycle. A thin fluid layer creates surface tension that naturally promotes collapse. A stabilizing substance normally counteracts this tension and keeps the lungs open. Adequate stabilization allows easy lung expansion with minimal effort. In preterm infants, this stabilizing substance is insufficient at birth. Without adequate stabilization, air spaces collapse at the end of every breath. Each new breath requires reopening collapsed lungs, greatly increasing breathing effort. In mild respiratory distress syndrome, some lung regions continue to function. In moderate disease, larger lung areas collapse, reducing oxygen entry. In severe respiratory distress syndrome, most air spaces fail to remain open. Blood continues to pass through collapsed lungs without receiving enough oxygen. Inadequate ventilation leads to carbon dioxide buildup. Continuous effort rapidly exhausts the newborn. Lung collapse also increases resistance to blood flow from the heart. Reduced oxygen delivery begins to affect vital organs. The brain and heart are particularly vulnerable during respiratory failure. Respiratory support helps prevent collapse between breaths. Keeping the lungs open reduces effort and improves gas exchange. Replacement therapy restores stability to immature lungs. With support, lung function improves as natural stabilization increases. Reduced effort allows sustainable breathing. Adequate lung expansion restores normal oxygen delivery. Most preterm lungs recover with timely support. Respiratory distress syndrome explains why preterm lungs collapse and why early support is life-saving.